Yes, I have just called him, and the thing is that there was a blackout of electricity in
Oh,
his town, and because of that, he just moved from that part to some other part, and he will be joining within 10 minutes.
okay,
So
okay.
in between, we can talk about our program. As you all know that the
Yes,
IFBH
yes.
is celebrating its 2000 day celebration, and we have decided to go with an introductory session on that, and it will be conducted on the 8th of February, that is on coming Sunday, from 9:30 to 4:30, and there are a lot of presentation from Western people as well as the Indian doctors are also there. And let me go through the program schedule. And the inauguration will be done by Advocate M. Wilson, Honorable MLA Kovalam, Trivandrum, Kerala. And the inauguration of the scientific session will be done by Dr. Ismail Said, the President of IFBH, and the prayer by Miss Arya, uh, third year BHM student from Adirasumam Homeopathic Medical College, and the welcome speech by Mr. Kiran Cham, Secretary IFBH, and the presidential address is by Dr. Jose Isaac, former principal, Trivandrum Homeopathic Medical College, and felicitations by Dr. G. Harikumar, uh, former Director of Homeopathy Department, Dr. Sugaran KV, the Principal, Sharda Krishna Homeopathic Medical College, and Mr. Parid Pawar, and is a former Deputy Director, Government Service, Department of uh, Kerala Service, and Mr. Sajan Edison, MD student, White Memorial Homeopathic Medical College. Auto thanks by myself. Then the second part will be by
Dr. Bindu John.
no, the introduction of the faculties by the first scientific session will begin at 11 a.m. and Dr. Jose Isaac will be introducing the same, and Doctor from Germany, Doctor. Doctor, can you read all those names from there?
Okay, okay. Dr. Olga from Russia and Dr. Elena Mentwen from Finland and Dr. Natalia from Russia and Dr. Inga Grotmaid, MD, pediatrician from Latvia, and Dr. Yuri Sagaino, pediatrician from Moscow. And
And that will be the post-lunch, pre-lunch session. And so the second session will begin after lunch and from 2 to 3:45.
yeah, Dr. Manoj will introducing the faculties. And Dr. Kiran A. Case of obstructive nephrology, and Dr. Bindu will present cancer and homeopathy, and Dr. Bindu BR will present about autism and homeopathy, and Dr. Jolly Janardana will present about the management of thyroid problems.
And after that, there will be a tea break. And during the tea break, Dr. Hibbert will be singing some song for us. He will be, and thereafter, the interactive session will be conducted by Dr. Binduraj and Dr. Mrs. Jidi Manoj. Photo thanks to the session will be by Dr. T.P. Anilkumar, and Dr. Ajini Maliagal will be the anchor of the day, and Dr. P. Shaila will be the floor manager. And this is how we are conducting the session. As you all know, this is just the beginning of the celebration. We will be trying to end up the celebration in April last at Bangalore, and that will be a big celebration. This one is all of a sudden we got a chance to have more than 25 Western doctors here, and all of them are joining, and they are willing to share some of the
Guest has
knowledge.
joined. Okay, doctor, you can continue.
Okay.
Okay, today's our guest is Dr. Alain Dutra, MD, MBA. He's a urologist with a training orthomolecular and functional and lifestyle medicine, specialized by American Academy of Anti-Aging Medicine. He has completed postgraduate medicine from Albert Einstein Hospital. Most active voice of integrative medicine. We are so happy and warmly welcome you, Dr. Alain Dutra. Sorry, sorry for my pronunciation. I'll make you as a co-host. Okay, doctor, you are welcome.
It's a great pleasure to be with you today, so I can have this talk about neuronal health. So it's a great pleasure to be with all of you, to share with you all my knowledge and perspective with natural medicine. Do you hear me?
Yes.
Okay, thank you. So can I start my presentation?
Sure.
Okay, thank you. Can you see my screen?
Yes. Alzheimer's.
Okay. So do you see my PowerPoint presentation?
Yes.
Okay. Anything else in the screen or just the PowerPoint presentation?
No, only the Alzheimer's disease, functional and integrative orthomolecular approach and complementary homeopathy. That's
okay, there's nothing else, any other screen on the being transmitted, just the screen of PowerPoint. Just confirm. Okay, I will just begin. So it's a privilege to be with you today. I want to share an approach to Alzheimer's that resonates deeply with your homeopathic training, because at its core, it's about understanding the individual terrain, the unique biological soil upon which disease take root. Nothing I present today replaces homeopathy. On the contrary, when we correct the biochemical imbalances underlying neurodegeneration, the homeopathic remedy finds a more responsive organism. So we are preparing the terrain so the vital force can express itself freely. Globally, over 55 million people live with dementia, 60 to 70% being Alzheimer's disease. And India carries one of the largest burdens. Approximately 8 million Indians over 60 live with dementia, a prevalence of 7%. By 2050, India may have over 24 million cases. And the economic cost is very big. It already exceeds $14 billion annually, most falling on families as informal caregiving. And these numbers demand immediate action. So what does conventional medicine offer to us? Cholinesterase inhibitors and memantine provide modest symptomatic relief for 6 to 12 months without altering disease progression, and the newer anti-amyloid antibodies, such as lecanemab and donanemab, show only 27 to 35% slowing of decline, cost $26,000 to $32,000 per year, and also carry serious risks, including brain edema in up to 24% of patients. For most patients in India, these costs are inaccessible and acceptable. Over 200 clinical trials targeting amyloid alone have failed, so this is a failure of the reductionist model. Alzheimer's is now understood as a multifactorial, systems-level disease involving neuroinflammation, insulin resistance, mitochondrial dysfunction, oxidative stress, toxic exposures, and microbiome disruption. So, many individuals with heavy amyloid burden have normal cognition. Others with devastating dementia have little amyloid. So, the quantity of amyloid is not the big issue. Amyloid is downstream, not the root cause. So this means we have multiple therapeutic targets to address. Dr. Deus Bredesen is a neuroscientist from the United States, identified 4 Alzheimer's subtypes. Type 1 is the inflammatory type. It's driven by chronic inflammation, metabolic syndrome, and infections. Type 2 is the atrophic type that is caused by loss of trophic support such as hormones, vitamin D, and growth factors. And type 3 is the toxic one, which is related to mycotoxins, heavy metals. It often presents in younger patients with atypical features. And also we have type 4, that is called vascular component with reduced blood flow and vascular insufficiency driven by cardiovascular risk and also elevated homocysteine. Most patients have a combination of 2 or 3 types. Later on, Dr. Bredesen added 2 additional types, the 1.5, the diabetic type, or glycoatrophic. There is a blend of types 1 and 2, and also type 5, that is the one related to repeated traumatic injuries. So this classification directs investigation and also treatment. We have a great concept of gut-brain connection. Is now considered causal, not merely correlational. So we have a study from 2023 in Science Translational Medicine that showed that gut bacteria from Alzheimer's patients transplanted into germ-free mice induced neuroinflammation. And a 2025 meta-analysis confirmed that probiotic supplementation improves cognitive function in Alzheimer's, and the bacterial lipopolysaccharide, there is a material from the bacteria, crosses a compromised blood-brain barrier and activates destructive inflammation. In India, your traditional emphasis on digestive health, Agni, aligns remarkably with what modern science now confirms. So the brain's immune cells, microglia, shift to a pro-inflammatory state in Alzheimer's, releasing cytokines that damage neurons. The blood-brain barrier breaks down early. A 2019 Nature Medicine study showed this predicts cognitive decline independently of amyloid or tau. Every source of systemic inflammation, such as gut dysbiosis, periodontal disease, metabolic syndrome, now has direct access to damage the blood and also to damage the brain. So neuroinflammation and blood-brain barrier is a very important feature in this disease. Also, insulin resistance. The brain is an insulin-sensitive organ. When brain insulin signaling fails, neurons starve despite adequate blood glucose. The enzyme that degrades insulin also clears amyloid. When overwhelmed by chronic hyperinsulinemia, amyloid accumulates in brain. So type 2 diabetes doubles Alzheimer's risk. For India, where diabetes prevalence exceeds 11% and is rising rapidly, this connection is particularly urgent. The brain consumes 20% of the body's oxygen. In Alzheimer's, mitochondrial energy production fails and reactive oxygen species accumulate, so the NRF2 antioxidant defense pathway is impaired, and compounds that activate NRF2, like sulforaphane from cruciferous vegetables and curcumin from turmeric, can restore these defenses. Mitochondrial dysfunction may actually precede and drive amyloid accumulation. Elevated homocysteine is independent Alzheimer's risk factor. We have a study, the Oxford VitaCog trial, that showed that B vitamin supplementation reduced brain atrophy by 30% over 2 years, 53% in those with homocysteine above 13, and the cost is not very significant. It is pennies per day. So this is profoundly relevant for India, where B12 deficiency affects 47 to 67% of vegetarians. So the use of methylcobalamin, 1,000 to 2,000 micrograms sublingual daily, is far more effective than oral cyanocobalamin. Let's talk about some key nutrients in brain health. DHA is a kind of omega-3, is critical for brain membrane function. 2 to 3 grams daily of combined EPA, DHA, curcumin in enhanced bioavailability form showed reduced brain amyloid on PET scans in this UCLA theracurmin trial. So turmeric with black pepper, its ancestral wisdom validated by pharmacology, and vitamin D supplementation was associated with 40% lower dementia incidence in a study of over 12,000 participants. In India, despite abundant sunshine, 70 to 90% of Indians are vitamin D deficient. Also, this is the case in Brazil. So our target is 50 to 80 nanograms for ml with 4,000 to 5,000 international units daily. Other very important nutrients, magnesium L-threonate is the only form shown to effectively cross the blood-brain barrier, enhancing synaptic density and memory. CoQ10 as ubiquinol is the most absorbed form, supports mitochondrial electron transport. In NAC is the most cost-effective way to boost glutathione, which is the master intracellular antioxidant. So those supplements are all available in India at reasonable costs. The MIND diet showed 53% Alzheimer's risk reduction with high adherence in observational studies, and the key components translate beautifully to India. Dal and legumes, abundant vegetables, walnuts, mustard oil. So the traditional Indian thali composed thoughtfully can approximate these principles at very low costs. So it's very important also to perform intermittent fasting, 12 to 16 hours overnight, which activates autophagy, that is the cellular self-cleaning that clears misfolded proteins, and many Indian traditions already incorporate fasting. Exercise is the single most evidence-based lifestyle interventional. 150 minutes weekly of moderate aerobic exercise reduces Alzheimer's risk by 28%. Yoga has specific evidence. Kundalini yoga improved memory comparably to formal cognitive training. Sleep is when the brain's lymphatic system flushes waste, including amyloid and tau. And our 2025 landmark study confirmed this clearance in humans for the first time. Even 1 night of sleep deprivation measurably increases brain amyloid. Chronic stress elevates cortisol, which is directly toxic to hippocampal neurons, which is the seat of memory. India's meditation traditions have growing evidence for neuroprotection. Kirtan Kriya meditation for just 12 minutes daily, improve cognitive function, and increase telomerase activity in a controlled trial. Pranayama, Vipassana, and Transcendental Meditation are accessible, free, and culturally embedded interventions. The full recode protocol costs a lot in the United States, at least $10,000 per year, and this is impractical for countries such as Brazil and India. But the principles can be adapted. Tier 1 essential labs available at, for example, in TiroCare or Dr. Lau Path Labs for 3,000 to 5,000 rupees cover the most impactful biomarkers. Tier 2 adds specialized tests for complex cases. An 80 to 20 approach addresses the 20% of factors driving 80% of disease. So we can implement the most of recode protocol in developing countries such as Brazil and India. It's not essential to have all this spend of $10,000 per year. Here's where our disciplines converge. Hahnemann's concept of chronic miasms parallels with what functional medicine calls the biological terrain. So the psoriatic miasm maps onto Bradeson's type 1 inflammatory Alzheimer's. The psychotic, with its excess and accumulation, parallels insulin resistance. The syphilitic, with destruction, resonates with the toxic type 3. When we correlate and correct biochemical imbalances, we are not replacing the remedy, we are turning the instrument so it can play its full symphony. When a beautiful indicated constitutional remedy like Baritacarba, Lumina, Phosphorus, Lycopodium gives a sluggish response in an elderly patient with cognitive decline, the biological terrain may be too depleted. So a B12 deficient, insulin resistant, vitamin D depleted organism lacks the substrates to mount a healing response. It is like trying to play a symphony on an instrument with broken strings. Correct the biochemistry and the remedy find its mark. So phase 1, access and correct the terrain over 4 to 8 weeks, order basic labs, correct deficiencies, address insulin resistance, restore gut health, ensure adequate sleep and exercise. So in phase 2, deepen and individualize from weeks 8 to 16, add targeted interventions based on subtype, and optimize homeopathic treatment on a now responsive terrain. Phase 3, maintain and monitor every 3 to 6 months, adjusting both approaches based on clinical response. So let's talk about some clinical cases. A 68-year-old retired school teacher, vegetarian, type 2 diabetes, body mass index 29, poor sleep, family history of dementia with a mini mental score at 22. Her homeopath prescribed Lycopodium with limited response, and labs revealed B12 frankly deficient at 148, homocysteine severely elevated at 28, vitamin D profoundly low at 14, poorly controlled diabetes, chronic inflammation. Now we understand why Lycopodium alone was insufficient. The terrain was devastated. So we initiate methylcobalamin, methylfolate, vitamin D, curcumin, omega-3, magnesium, mind diet, and daily walking. So at 8 weeks, labs dramatically improved. The homeopath continued Lycopodium. This time, the response was qualitatively different. At 6 months, the mini mental state improved to 25. Neither intervention alone would have achieved this. Together, they create synergy. This is integration, not competition. So your remedy choice tells you where to look biochemically. Barita carbonica with premature senility, investigate cardiovascular markers and thyroid. Alumina with confusion, consider aluminum toxicity, phosphorus burning out, excess oxidative stress and adrenals. Lycopodium with digestive complaints, evaluate insulin resistance and gut health. The remedy guides biochemical investigation. The biochemistry refines remedy choice. So the practical, affordable protocol, foundation level for every patient costs approximately 1,500 to 2,000 rupees per month, roughly 12 to 24 US dollars. Add enhanced intervention for specific findings at an additional 1,500 to 2,500 rupees, total under 5,000 rupees monthly, a fraction of conventional Alzheimer's medication, and addressing root causes rather than downstream symptoms. Let's talk about important caveats. Early intervention is crucial. The window for maximum benefit is mild cognitive impairment and early Alzheimer's. Simplify protocols for elderly compliance, monitor interactions. The future lies in multimodal, individualized medicine. The Finger 2.0 trial now runs across 60 countries, including India's in-finger arm. The convergence of functional medicine, homeopathy, and Ayurveda represents a powerful synthesis, particularly suited to India. So, Alzheimer's is not an inevitable consequence of aging. It's a modifiable process. Every deficiency corrected, every inflammatory pathway calmed, every mitochondrial supported. These are cumulative investments in neurological resilience. Combined with the depth of homeopathic treatment, we offer something neither discipline achieves alone. We offer not just more ears, but more life in their ears. Thank you. And also, we are going to address another exposition. Now we are going to talk about autism. We're going to share an approach to autism spectrum disorder that integrates homeopathic thinking with biochemistry. Let me start with numbers that demand reflection. Autism prevalence jumped from 1 in 150 children in 2000 to 1 in 36 in 2023, according to the US CDC. So this isn't just improved diagnosis. Something has changed in the environment, in nutrition, in epigenetic factors, and this is where the functional and ultramolecular approach give us concrete tools. Clinically, autism rests on 4 pillars. First, social integration, difficulty with eye contact, recognizing expressions, forming friendships. Second, communication, repetitive language use, difficulty initiating conversations. Third, the behavior, stereotypes, rigid routines, restrict interests. Fourth, and very relevant to our case taking, sensory sensitivity, aversion to touch, or conversely, excessive need for physical contact. So regarding the diagnostic timeline, warning signs can appear in the first months of life. From age 2, diagnosis is technically possible. The key point, diagnosis before age 4 exponentially increases chances of stimulating neuroplasticity. Our clinical acuity in early detection is the first step toward any successful intervention. Modern science increasingly understands autism not as a single entity, but as an umbrella term. The autisms Although diagnoses follow unified DSM-5 criteria, the underlying etiology varies drastically between individuals, involving hundreds of genetic variants, epigenetic interactions, and also environment factors. This heterogeneity means autism represents the common outcome of distinct biological pathways disrupted during critical brain development. Studies identify subgroups with completely different biological profiles under the same diagnostic code, from synaptic dysfunctions and channelopathies to mitochondrial dysfunctions, neuroinflammation, and gut-brain axis dysregulation. This biological diversity explains why an effective intervention for one patient may be completely inert for another. The autism diagnosis, like fever, functions just as a generic descriptor, not a single case diagnosis, requiring deep investigation to identify specific mechanisms in each patient. An umbrella review in Nature Human Behavior, January 2025, analyzed 248 meta-analyses on complementary approaches in autism, and a key finding: up to 90% of individuals on the spectrum have used some form of alternative medicine, and to this day, no approved medication acts on core autism symptoms. Risperidone and aripiprazole are approved only for irritability. Before treatment, we need to understand what's happening inside these children's bodies. Think of autism as affecting three interconnected systems, like gears. First, the gut-brain connection. Second, chronic neuroinflammation. Third, failure in cellular energy production. When one gear jams, the others suffer. Let's look at each one. The gut-brain connection is perhaps the most fertile research field of recent years, and here we have something very practical. Up to 70% of children with autism present gastrointestinal symptoms such as constipation, diarrhea, abdominal pain, and bloating, and these aren't coincidental. Studies show they have a different gut bacteria composition, fewer butyrate-producing bacteria and more bacteria producing toxins. Butyrate is like fuel for intestinal cells. It maintains the intestinal barrier and has anti-inflammatory brain effects. Excess propionate, on the other hand, induces autism-like behaviors in animal studies, such as repetitive actions and difficulty with social interaction. This gut flora alteration doesn't stay in the intestines. The barrier becomes more permeable. The term leaky gut is very used, and bacterial fragments enter the bloodstream, activating the immune system and also generating systemic inflammation. Neuroinflammation in autism is like a low-grade fire that never goes out. Microglia remain on permanent alert, releasing inflammatory substances such as interleukin-6, interleukin-1 beta, and TNF-alpha. This chronic inflammation interferes with synaptic pruning and normal brain development, and also a 2024 study identified an axis between TNF-alpha, sphingolipid metabolism, and steroid hormones, which may partially explain why autism is more common in boys. The third gear is the mitochondria. A 2024 meta-analysis showed 41% of children with autism had elevated pyruvate, 70% elevated lactate, 15% elevated alanine, an estimated 30 to 50% have some degree of mitochondrial dysfunction. And here's the connection. Chronic inflammation damages mitochondria. Damaged mitochondria produce more free radicals. dysbiosis, increases inflammation. It is a self-reinforcing cycle. Now, a system's fundamental in autism, through methylation, the methylation cycle. The body has billions of switches that turn genes on and off. So methylation operates those switches, needing B12 and folate as cofactors. A meta-analysis of 22 studies showed children with autism have significantly reduced methylation capacity. The sum to SAH ratio is nearly 1 standard deviation lower than controls, so this affects neurotransmitter synthesis, detoxification, and gene expression. Think of the methylation cycle not as an intimidating biochemical map, but as the master gear body functions. Think of it as a transfer system for a simple chemical currency. The methyl group passed from one molecule to another billions of times per second. This is what allows genes to be turned on and off, DNA to be repaired, and neurotransmitters to be synthesized. Two major circuits interact, the folate cycle and the methionine cycle. The main product is SAM, or S-adenosylmethionine, that is the universal methyl donor. Without it, cellular repair and maintenance simply stop. So essential cofactors include methylfolate, B12, and B6. The MTHFR enzyme is the vital bridge that converts dietary folate into its active form, allowing the cycle to turn and recycle homocysteine back into methionine. So the transsulfurization pathway handles the leftovers. If homocysteine isn't recycled, it's diverted to produce cysteine and glutathione, our master antioxidant. When this cycle fails, whether from nutritional deficiency or genetic polymorphism, we accumulate homocysteine, generating inflammation and oxidative stress, and fail to produce elements needed for detoxification and DNA repair. Treating this cycle means optimizing the patient's biological terrain, ensuring the biochemical foundation for healing is established. So why does methylation efficiency drops? Many children with autism, 58 to 76%, have antibodies against the brain's folate receptor. So folate can't enter the nervous system adequately. In the good news, folinic acid uses an alternative pathway to enter the brain, so the FDA, the American FDA, recently approved leucovorin for cerebral folate deficiency. Another compromised system is tetrahydrobiopterin, or BH4. It's necessary for producing dopamine, serotonin, and norepinephrine. So a 2025 review confirmed children with autism have reduced BH4 levels. The body appears to divert it from neurotransmitter production to use as an antioxidant because of excessive oxidative stress. This partially explains mood alterations and emotional regulation difficulties. A frequently overlooked aspect is trace amines like tyramine and tryptamine produced by both the brain and gut bacteria that modulates dopamine and serotonin through TAAR receptors. Dysbiosis alters their production, yet another connection between microbiome and behavior. We can't ignore prenatal factors. Maternal immune activation during pregnancy significantly increases the risk of autism. Animal models reproduce autism-like phenotypes when the mother faces inflammatory stimuli during pregnancy. Preventive interventions such as adequate nutrition, optimal vitamin D, minimizing infections can impact prevention, something to discuss with pregnant patients. Now let's go to the practical assessment. So an initial panel should include vitamin D, frequently low in these patients, serum B12 with a functional ideal above 600, folic acid and homocysteine, ferritin, zinc to copper ratio, and also erythrocyte magnesium. For deeper investigation, MTHFR polymorphism testing, the C6077T variant in homozygosy reduces folate activation, requiring methylated B vitamins. So, folate receptor antibody testing is necessary for selected cases. The most comprehensive tests for evaluating overall biochemistry are urinary organic acids, such as metabolomic tests, but they are very expensive and hard to interpret. So let me share what I call the poor man's organic acids, the most accessible mitochondrial screening, serum lactate and pyruvate with the radio. So when mitochondria aren't working properly, energy metabolism shifts from the anaerobic pathway to the producing lactate. A ratio above 20:1 signals oxidative phosphorylation dysfunction. So the advantage is that this radio distinguishes respiratory chain defects from other causes of lactic acidosis. So it's an inexpensive test available in virtually any laboratory. And creatine kinase is another affordable marker. Persistent elevation without intense exercise may indicate mitochondrial myopathy. If resources are available, urinary organic acids testing tells a metabolic story, such as elevated succinate, fumarate, and malate, suggests Krebs cycle blocks, elevated lactate and pyruvate point to respiratory chain compromise, homovanillic acid, and also 5-HIAA offer a window into cerebral neurotransmitter metabolism. Dysbiosis markers are also very useful. The arabinitinol and tartaric acid indicate fungal overgrowth. HPHPA indicates Clostridium dysbiosis. When we find this, we know exactly what to treat, far more precise than generic probiotics for everyone. Regarding interventions, the Nature Umbrella Review didn't find robust evidence for core autism symptoms. However, through systems biology and P4 medicine, by understanding each patient's unique biological network, we move from generalization to precision. When we treat specific dysfunctions, we observe significant responses that population average studies can't capture. Starting with basics, vitamin D target 50 to 80 nanograms per ml with K2. A 2025 study using 300 units per day per kilo per day showed reduced inflammation and behavioral improvement in these children. Folinic acid, not regular folic acid, 0.5 to 2 milligrams kilo day in 2 doses. Methylcobalamin, 1,000 to 2,000 micrograms a day, sublingual or injectable. For mitochondrial support, the mitochondrial cocktail, we can use L-carnitine, 30 to 50 milligrams per kilo per day, ubiquinol, 100 to 200 milligrams per day, alpha-lipoic acid, 200 to 600 milligrams per day. A double-blind study showed significant improvement in mitochondrial markers and behavior with large effect size. For the gut, we can use probiotics, Lactobacillus rhamnosus, Bifidobacterium infantis, Lactobacillus reuteri at 10 to 50 billion units per day, introduced gradually, prebiotics such as galacto-oligosaccharides, in some cases direct butyrate supplementation 300 to 600 milligrams 2 to 3 times daily. Sulforaphane deserves special mention. A 2025 meta-analysis with 6 studies and 333 participants showed significant improvement in social interaction. It activates NRF2, switching on hundreds of cellular protection genes, and the dose is 1 to 2 micromoles per kilo per day using standardized preparations. N-acetylcysteine, a glutathione precursor at 600 to 1,800 milligrams per day, has shown effects on irritability. Children with autism consistently showed reduced glutathione and elevated oxidative stress. For sleep disturbance affecting up to 80% of children with autism, melatonin 1 to 6 milligrams 30 to 6 minutes before bedtime. Melatonin is also synthesized in mitochondria and functions as a potent mitochondrial antioxidant, an elegant connection between circadian rhythm and cellular energy. Omega-3, especially EPA, 1 to 2 grams per day for inflammatory modulation, zinc, 10 to 30 milligrams a day, and chelated magnesium, 6 to 10 milligram kilo day, cofactors for hundreds of enzymes, frequently depleted. Let me illustrate with a clinical case. A 5-year-old boy, moderate autism, diagnosed at age 3, chronic constipation, sleep disturbance, extreme food selectivity, frequent irritability on risperidone with significant weight gain. Investigation found vitamin D at 18, ferritin at 15, borderline zinc, organic acids showed elevated Clostridium markers, folate receptor antibodies positive. So let's see how each finding guided a specific intervention. We started vitamin D 4,000 units a day with K2, chelated iron 15 milligrams a day, zinc 15 milligrams a day, specific probiotics for the identified dysbiosis, folinic acid 1 milligram per kilo per day, given the positive antibodies, and sublingual methylcobalamin 1,000 micrograms a day. The progress over 3 months was gratifying: resolution of constipation, significant sleep improvement, greater connectedness and initiative in interaction, and a major reduction in irritability crisis. This allowed a gradual reduction of risperidone, and the family reported he was a different child. The second case is an 8-year-old girl, also autism level 1, chief complaint of disproportionate fatigue, mild hypotonia, regression of fine motor skills after a febrile episode, vitamin D at 22, B12 at 280, normal but below functional ideal, organic acids revealed clear mitochondrial dysfunction markers, low free carnitine. So the protocol focuses on the mitochondria. L-carnitine started gradually up to 50 milligrams per kilo, ubiquinol 100 milligrams twice daily, alpha-lipoic acid 200 milligrams twice daily, riboflavin and thiamine as cofactors. We corrected vitamin D to 5,000 units and started methylcobalamin 2,000 micrograms a day. Within 8 weeks, just a minute. Within 8 weeks, the child could tolerate physical activities that previously exhausted her. At 3 months, there was recovery of the lost fine motor skills, and the teacher reported a significant increase in attention span, and follow-up labs showed normalization of the markers. A vague complaint of lack of energy was transformed into a precise diagnosis and effective treatment. These are some trials that are ongoing now, where research is heading. This first trial evaluates spectrum needs, a broad-spectrum vitamin mineral cocktail with a special CoQ10 formulation in a rigorous double-blind crossover design. So we have ongoing studies looking at these nutraceutic components to address autism. This other study combined a low FODMAP diet with probiotics and showed improvement in gastrointestinal symptoms with a trend toward improvements in irritability. So some practical considerations. First, the order matters. Start with nutritional deficiencies, gut support, and sleep regulation. Then move to specific interventions such as mitochondrial support or folinic acid. Introduce one at a time, 2 to 4 week intervals to evaluate response. Second, document. Use validate scales such as ABC or CARS, befores and after. Repeat labs. This is so you know whether you're on the right track. Final considerations. Maintain realistic expectation. We are not proposing to cure autism. We are optimizing the biological terrain so each child can express their maximum potential. Some respond dramatically, others modestly. The spectrum is heterogeneous. Fourth, these interventions are complementary. Behavioral therapies, speech therapy, occupational therapy remain fundamental. We create a more favorable biological substrate so those therapies work better. Now, integrating with homeopathic practice, because I believe these approaches complement each other naturally. Homeopathy acts at the level of the vital force, the dynamism of the organism. The orthomolecular approach acts at the biochemical substrate. These are different levels of intervention, but not mutually exclusive. Think in this way. If a child has zinc deficiency, mitochondrial compromise, and gut dysbiosis, even the best indicated homeopathic remedy may have difficulty acting fully because the terrain is out of balance. It's like trying to tune a piano that's broken. Correcting the biochemical foundations doesn't replace homeopathy. It prepares the terrain for homeopathy to work better. In my experience, the homeopathic remedy seems to work better when the organism has the necessary cofactors to respond. Just as in homeopathy, there is no the remedy for autism, in the functional approach, there is no the protocol for autism. Each patient has their unique pattern of dysfunctions. Laboratory investigation identifies the individual patterns, just as repertorization identifies the individual remedy. Each child on the spectrum is unique. Precision medicine in autism isn't futuristic theory, it's careful identification and target correction of each patient's specific imbalances. It is, in a way, what we have always done in homeopathy, treat the individual, not the disease. So how do we communicate this to the families? I explained that we are optimizing the biological terrain so the child can express their maximum potential, not promising a cure, promising careful investigation and evidence-based interventions. When framed this way, expectations become realistic and adherence improves. So the accumulated scientific evidence, especially over the last 3 years, supports this approach as a valuable complement to conventional autism management. Families are seeking these options. Up to 90% have already tried complementary approaches. Our role is to offer science-based guidance with safe protocols and adequate monitoring, and the results, when the approach is well conducted, are frequently gratifying. Colleagues, thank you very much for your attention. I'm happy to discuss cases and go deeper into any point that may still be unclear.
Thank you so much, Dr. Alain Dutra, for your wonderful session. And it was really wonderful because it's a great awareness for us and very informative and insightful session it is. The participants, if you have any question, means you can raise your hands and ask question to Dr. Alain Dutra regarding the session. Dr. Manoj?
Yes, congratulations. Well compiled on a really, a promising and progressing one. Because you know that the functional orthomolecular approach, it is essentially the maintaining cause. How to correct the disease conditions or help to cure disease by understanding the exciting cause, maintaining and fundamental cause. Here this is exactly the maintaining cause. We all know that deficiencies are always. Then of course, the two types of the effects we are expecting in disease cases. One is the specific stimuli and another is general stimuli. As according to Dr. Danna, this is a general stimuli. And also a comprehensive knowledge in biochemistry will definitely bring some miracles in treatment of this kind of diseases. And as you mentioned, around 55 million people are suffering from this Alzheimer's disease and dementia. And of that, 7.4% in India. That's a major, really a major setback for these developing nations because of this dementia and autism. So a nice attempt and congratulations for your endeavors. Thank you.
Thank you, Dr.
Thank you very much.
And Dr. Danesh?
Yes, Dr. Alain Dutra, it's really an excellent session. Dr. Najib from Gulf has presented a session on the same functional medicine. And we got ideas about these functional medicine during the presentation. And you have given some more cases with this presentation. And this shows the need for eye systems as well as this alternative systems for the betterment of patients in the shortest possible time. Anyway, congratulations and hope you can come over here and deliver some more presentation in the future. Doctor, what is your approach? Whether you have tried functional medicines with the homeopathic medicines?
Yes.
Dr. Alain Dutra?
Doctor, please, can you hear? Doctor?
Dr. Alain Dutra?
See, I'm here.
Have you ever utilized homeopathic medicines along with these functional medicines for treatment?
Yes, the great challenge here in Brazil that I imagine is the same challenge in India is that much of the nutraceuticals that we use here for treating the diseases, the chronic disease, are expensive for most of the population. So we try to use styles medicine, lifestyle medicine, the most we can, so we can decrease the costs. And also I use the nutraceutical approaches to improve the biological terrain, so we can use homeopathic remedies that are much more affordable. Did I answer your question?
Yes. Thank you. Yes, Dr. Rajini, you can make an announcement of our sessions once again so that those who
Yeah, we are celebrating our 2000 days celebration on this Sunday at Kovalam. So many participants from Russia, Denmark, and
Great.
Latvia, they are presenting their papers there, and we have guests from India also. And moreover, we are meeting together. Normally, we are seeing on virtual platform, and on Sunday we will meet there. And if anyone have interested to join, you can also inform us. Thank you so much.
Yes. There is 5 more slots remaining.
Yeah, if anyone interested, you can also join. Now it is the time to move to the Malayalam session. I am so thankful to Dr. Alain Dutra. Come again and share your knowledge, and I'm appreciating your effort to study about all these things, and your good heart to share your knowledge to us. Thank you so much. Here India, now we are
It was a great pleasure to be with you.
Thank you so much. Thank you so much. We are just started the precision medicine here, not at practicing. Some are introducing this. Just we are started. Anyway, thank you so much. Come again. Love you all. Good night. See you the same time tomorrow. Bye bye. And
Bye-bye.
I'm inviting Dr. Mariamma John for moderating Malayalam session. You are welcome, Dr. Mariamma John. Please.
ഒരു introduction